So we're talking patient experience, and we've kind of got a fun little surprise for you today. Well, come on over.
My name is Caden Nash, and my physician is Dr. Dresbach. Dr. Dresbach is the reason why I walk and talk today. In 2003, I had what now we know was a small stroke. However, at that time, I didn't have a physician, and with the dart, we picked Dr. Dresbach. Went into the office, and when I met him, I thought, holy crap, he's awfully young. He was funny right off the bat, told extremely dumb jokes, and I knew, okay, I'll be okay. He put me in the right direction. No matter what was going on, even to this day, when I go into his office, he just makes sure that, one, he asks me, like, what's going on? How do you feel about A, B, and C? And are you sure about that? But the nice thing is that he always asks the questions, and he listens. This is a guy that will not give up. When we tried to get into the Mayo Clinic the first time, because I was not diagnosable, he would call and he would explain why it was taking so long, and again apologize. But the mere fact that he was the one who was calling and saying, hey, this is what's happening, this is what we're gonna do next, that's another sign of respect also, but not just respect, that he saw you or me as a person, and not just a paycheck. I don't even know if there was enough time in the day to explain exactly what that guy has done for me. I know that he doesn't just do it for me, he does it for all of his patients.
Wow. Pretty generous. To that I reply by saying, I pay my patients well to say good things about me. So. Caden came to me with a lot of unknowns, a lot of questions. The biggest thing with all that is patience. It's going to be trial and error, and the biggest thing Caden gave me is the trust and the patience to let us work through the process. It's overwhelming to see that gratitude put into words. It's important for Caden to know that that's a two-way street, though. As much as he's benefited from the relationship, I have as well. And I don't know that he understands how much he's taught me along the way. It's hard to learn if you're talking. It's hard to teach or educate if you're quiet. So trying to find the right balance between the listening and the communication is fundamental, I think. First time that I meet people, I like to establish up front kind of my philosophy and my style of practice. That it's a communication. It's not me telling you what to do. I want people to make their own decisions with the best information they can get. I try to show respect to my patients by acknowledging their concerns and talking about options on how to proceed. So Caden stuck with it, and he's not somebody that I met last year. He's been with me almost my entire practice, I think. So it's really exciting to see where he was and where he is now, and to hear him describe all those things, it almost seems unreal that we went through all that, looking at how functional he is now and how good things are. So it's pretty overwhelming. It's good to add that to the happy bank for future withdrawals.